Hi, welcome to today's Myofascial Moment. I've got about 10 to 15 minutes on my lunch break. I want to work a little bit with my own hip mobility. Now, this is a bit different from when we talk about floor sitting in general. We do have a 21-day floor sitting challenge that's going to encourage you to spend 10 to 15 minutes each day sitting on the floor in a variety of positions. Today, however, I want to specifically work with some mobility in this 10 to 15 minute segment. So I'm not going to stay here cross-legged like this, but I do have a wall close behind me if I do end up needing a bit of support behind my low back. So when I work with my own hip mobility and floor sitting, I tend to sit in this kind of side bent position. I'm going to turn here a bit so you can see. Essentially, you want to find a way for your legs to get into the same side bending direction. Now, when you do, you're likely going to find some sort of restriction here in the hip area, possibly in the knee. It might be something here in this leg. Find a way to be comfortable seated. You might need your leg farther behind you. You might need it a bit closer in front of you. You might need to prop something under this leg. Again, play with what you need in particular for your body. But when you find a comfortable position, I like to try and see if I can start to get my sits bones, both sides of my butt, down on the ground. That's the first place I start. And again, I just have 10 to 15 minutes. So this is going to be slow and gentle movement for a specific purpose. So I use my arms just a little bit. What I want to do is start to settle in to my pelvis. And for me, again, this is my myofascial treatment here in the middle of the day, I start to feel a tightness right here in the joint as I start to ask my pelvis to come more centered. So I'm on both sits bones. When I find that tightness here, I like to actually put my hand there so I get a bit of my own compression. Now I've got some support here, I'm not really leaned over, tipped over. I have some good gravity-based compression on my own hip. I'm just going to sink in here for a minute. Now, what you won't see is that I'm starting to lengthen out my leg this direction. I'm not collapsing in. I'm actually starting to use my body to kind of telescope in a long line this way. Find what works for you. This happens to be what my hip needs at the moment. Now I've come off my sits bone. That's a bit different from what I described at the start, but I'm starting to work with this restricted area that I found as I did ask myself to center up. So again, if you remember, good myofascial self-treatment is over a 3 to 5 minute period of time as you start to slow your breathing, quiet your mind, and settle into your body, engaging with an area that's tight, hard, tender, restricted in some way. Again, I know this area of my hip tends to prevent some good flexion, some good rotation. Now, as I stay here, I'm starting to feel my femur, this leg bone, kind of drop toward the floor. That's providing a good stretch through my adductor, through my inner thigh. Starting to feel this affect my knee just a bit. And again, I've worked with this quite a lot, so I know my own limitations. I know kind of what this leg does. I tend to have a bit of a twist in this upper leg due to some scar tissue from C-sections several years ago. So I just try and keep it mobile as best I can. Again, as I soften and settle into my own body, I can feel my pelvis settling differently. Now you might find a bit of motion, almost a floaty, drifty type of motion happening in your own body. We call that unwinding. It's the body's natural self-corrective mechanism, intuitive, instinctive self-correction. You don't really want to get in the way of that motion. Again, it's subtle, you might not see. My pelvis is shifting a bit back and forth as this softens here in my hip area. What this does is it allows me to sit back a bit differently. A lot of times I'll talk about breathing into an area of tension. Almost like you imagine a balloon. As you breathe in, it's inflating with your breath, and as you exhale, that balloon deflates a little bit. This is especially helpful with hip sockets. To breathe into that hip socket, almost like you can feel it expand with your breath. Hips are something I tend not to like to rush. Quality of myofascial self-release is a whole lot more important than quantity. A lot of times people will ask me, well, is it better to do more? Maybe. It's better to do it well. As I've stayed here, I can feel this area under my hand that I started with that was quite tender. That's eased quite a bit. So as that's eased, I'm going to start to play with that movement just a bit, just to kind of test what's different there. And then bring myself more up towards center. And with that hip, that's quite a bit easier to come more center onto both sits bones. So you can stay there longer depending on what you find in your own leg, or you might be ready to move on to the other one. Now, when I do this, again, I do tend to like to test motion. So a lot of times I'll just slowly test motion. I've had that in a bent position. You might have heard that just snap. I'm never quite sure if that's in my knee or my hip. Actually, that's in my hip. I like to test motion just a bit in that newfound space. And then when I'm ready, I swap sides. Same thing here. You might notice immediate difference. I don't sit quite the same. This hip doesn't go down nearly as much. I can barely get my sits bone down on that side. That's a lot of tightness here in the front of the leg for me. I don't feel that restricted here. It's almost entirely in the front. So I have to shift just a little bit to get into that area that's tight. Again, I do that primarily with my own hand. I tend to feel around where is it most sensitive. Now, you don't want to cause yourself pain here, but you do want to engage with an area that's tight, hard, or tender. Yeah, right here in front. Now again, I tend to get a good bit of support here. I got good wrist support. This doesn't tend to bother my arms or shoulders. If it does cause some trouble for you to get your own hand into an area that's tight, hard, or tender, go ahead and lean against a wall, prop against a pillow. Give yourself some good support. You're going to be here for 3 to 5 minutes, or I'd encourage you to be here for 3 to 5 minutes. Again, I've been working with this for a while, so I do tend to know some of my own trouble. This is an excellent way for me to do some good myofascial treatment on my own legs. As I work with some compression into areas of restriction, I tend to feel this through my pelvic floor. I tend to feel this through the inside of my foot that's bent back, through my adductor, quads, glutes, hamstrings. This is a good whole leg self-treatment. What you want to do, what I would encourage you to do, is just get quiet in your mind. Soften where you can in the rest of your body. I do tend to get my own shoulder up around my ear. I like to see if I can let that drop just a little bit. Start to quiet in your mind, soften in your body. As you stay here, you might start to notice a stretch, something that feels like it's melting like taffy. You might start to feel this again in other areas of your leg. I tend to get a really good stretch through the adductor eventually. A lot of times always with my own self-treatment, I do eventually need to start to breathe into this space for myself. I do want this to be effective treatment for me. That is after all, a myofascial moment, my lunchtime self-treatment. When I talk, I tend to start to brace just a bit in my pelvic floor, sometimes in my low back. Slowing your breathing can help. Imagining those spaces opening, lengthening, melting, stretching. Find the word that works for you. Breathe into those tight spaces. Ooh, that's starting to get into my hip socket now in a really good way. If you do tend to slip on your pants or on your leg, it is most recommended to be on skin here. I don't have any shorts at the office at the moment. Do what works in the atmosphere, in the environment you're in. Again, one of the aims of this is to make self-treatment, make self-myofascial release easy, accessible. It doesn't have to be time-consuming. It doesn't have to be difficult. I took off my shoes and socks. The mat's optional. It looks good in the photos. Find a place you can sit. I do this a lot at airports. Excellent if you're traveling by airplane, happen to have a layover while you wait for your flight. Find a quiet spot, a relatively clean spot, and do some work with your own hips before you sit for that flight. Again, that's a good stretch through my own adductor. I'm able to compress just a bit more. It may not look like it, but I'm not really pushing. It's more I've got a sense of something tight and hard under my hand. And as I soften in my body even more, that opens a bit more through the hip joint. I mentioned when we started I didn't feel this in my hip joint. I do now. That's not uncommon. As you stay with a release for 3 to 5 minutes or longer, because the myofascial system of the body is totally connected, head to toe, top to bottom, front to back, side to side, as one area softens, as tissues change, as they start to glide and be able to move again, it is very common to start to feel things pull into other areas of your body. It's actually a good sign that you're doing some good work. It's not required, but if other things start to speak up, your awareness of what's going on in your body is increasing. It's a good thing. What you want to do is soften even more into those areas that kind of give you a bit of a twinge, like my hip is at the moment. It's a natural tendency to brace, to clench around something that hurts. It's counterproductive to good myofascial release. You actually want to soften where you can. Again, you might feel a bit of motion, almost a floaty, drifty motion in your body. You don't really want to get in the way of that motion. Let the tissues unwind. And something just ease. The body almost always has a natural stopping point. Now I could really easily find the next layer, but something just shifted right here in my hip socket. This is a lot less tender again, which I like. So I'm going to, again, much easier. I still can't get all the way down on this right side, but gonna nudge my sits bones more towards center. That's a different experience than when I started. Now I have to push quite a bit with this leg. I still have some trouble balancing in my own pelvis, but that feels quite a bit different. And again, I like to kind of move gently before I move all together. Just testing a bit more extension. I like to do a bit of rotation. Yeah, that was some good work. Thanks for joining us. We'll see you next time.